Hello and welcome to Venomcast. I am here in Nairobi, Kenya, and I have the incredible pleasure of meeting Miss Dorothy Okemo. Dorothy is Executive Officer and Program Manager at the Access to Medicines platform based in Nairobi, and they're working all around Kenya on snakebite mitigation and also a lot of very pressing public health issues. So it's so nice to meet you, Dorothy.
Thank you.
So, can you tell me a little bit about how you got involved in Snakebite?
Yes, thank you, Chloe, for that question. We actually got involved in the Snakebite work as a result of our collaboration with Health Action International because we were actually part of the small team of civil society organizations that had the pleasure of being invited to participate in the WHO Global Strategy on Snakebites, and at the point at which snakebites were declared neglected tropical diseases. And so our interest to work in this area was actually picked at that particular moment. However, because we actually work at the community level, the fact that we encounter many people that have fallen victim of snakebite cases and are not able to either get treatment or do not know what measures they can take in terms of reducing the incidences. This is what actually led us to start also working on snakebites at community level.
Yeah, so you were telling me that Access to Medicines platform has been working in snakebite since 2019. So what kind of work have you been doing in snakebite?
Yes, so when we started working in the space of snakebites in 2019, the first thing we realized is that there was nobody else that was working in snakebites in Kenya. And so naturally, the second thing that we quickly realized was that there was absolutely no data on the magnitude of snakebite cases in Kenya. So of course, the first thing we embarked on doing is to actually undertake research to first of all understand what the magnitude of the snakebite incidences was in select counties in Kenya. Kenya has a devolved health system and we have 46 counties. And so we started off by doing a research in 6 counties just to see what the extent of these snakebite incidences were on the first hand. Secondly, to also get some perspectives from community members on what they know about snakebite, what kind of beliefs and myths they have, and how do they go about in terms of getting care and treatment for snakebites. And lastly, we also looked at the knowledge levels of healthcare workers. How well equipped are they to treat and manage snakebite cases? How confident are they to utilize antivenom and other commodities? And we also went further to look at the issue of availability, affordability of commodities for treating snakebites to see if this was also another factor that really hindered access and treatment. And lastly, we also thought it would be important to look at the socio-economic consequences of snakebites just to see to what extent this devastation of snakebite actually goes within the community level.
Great. So, as you're speaking to people in the communities, what kind of actions are people taking after they experience a venomous snakebite?
Yes, we realize that many people do not really know what to do when they are bitten by a snakebite. And so, usually when they get bitten by a snakebite, they really resort to the traditional methods that they all know. One of those methods is actually the use of tourniquets. So when you're bitten by a snake, they all believe that you need to tie just above the site of the bite to prevent the venom or the poison, as they call it, from spreading around the body. The second thing they do is to place a stone. There's a popular black stone that is used traditionally. And the community members believe that when you put this stone at the site of the bite, it actually sucks out the toxins and the venom somehow. Of course, the others include using herbs, putting ash, and of course visiting the witch doctor who is known to have concoctions that treat snake bites. So these are some of the myths and misconceptions that we actually encountered in the field when we visited the community members. And of course, then we realized that our work is really cut out for us to try and educate them on what exactly they need to do when they're bitten by a snake bite, even as they try to reach the nearest health facility.
And do you know why the World Health Organization is no longer recommending tying a cloth above the bitten site?
Absolutely. I'm aware of the reasons why tying above the site of the bite is not recommended anymore. And this has become really part of the messaging that we are giving to the community members when we do our community engagements and sensitization. The reason is that when you tie above the site of the bite, you are actually not preventing any of the venom or the toxins from circulating around the blood, through the bloodstream. Because as long as your blood is pumping and you're breathing, of course, the blood is still circulating around your body. But most importantly, what this is doing is actually limiting blood flow and circulation around that area where you have tied, which means that the action of tying that site can actually be more devastating than the snake bite itself, because then we have had instances where the blood flow is cut off from that particular area or limb, which leads to that area either getting gangrenous and leading to loss of limbs, which has nothing to do with the bite, but everything to do with the fact that that area was tied really tightly for a long period of time. And so for those reasons, the World Health Organization is no longer advising the tying of cloths or anything near the bite site of a snake bite.
Thank you. And what is the danger of using some of these other traditional medicines like herbs or concoctions?
Yeah, and this is a really good question, because it's exactly what the community members ask us. They wonder, why are we discouraging them from using the traditional methods which they have used for many years? And, frankly, we actually do have really good reasons why they should not use these methods. For example, when a snake bites you, usually it leaves an open wound. And so when you go ahead and start introducing things that you do not know, you start introducing juice from leaves that you do not know what those leaves do, you start introducing ash, you're probably introducing more germs and causing more harm to yourself while not actually treating the issue of the snake bite. If you decide to cut, because some of them believe when you're bitten by a snake bite, you make really sharp incisions and then you press out the toxins and the venoms to come out, this is actually very dangerous, because at the time when a snake bite is happening, usually it is very sudden and it's an emergency, which means there's nobody at that time who has been well prepared to use a sterilized knife or razor blade to cut themselves. So chances of actually getting tetanus as a result of cutting yourself to remove the poison is actually very high. So what we are saying is that it is very dangerous to use some of these traditional methods. And the other reason why we discourage them is because it also wastes a lot of time. Can you imagine somebody that has been bitten by a really venomous snake and they're still going around looking for herbs, ashes, and crushing them and applying them, while they should have been using that time to actually take the patient to the facility? So it really wastes time that could have been used to treat the patient and in many instances save lives.
What are the motivations that people usually have for using these traditional medicines rather than going directly to the clinic or hospital?
Yeah, the motivations why people, even in this day and age, are still using traditional methods is really actually sad. As you know, snake bites are neglected tropical diseases, which means they occur in neglected settings among rural communities that are economically disenfranchised. So one of the reasons that makes them actually continue to use these traditional methods is economic reasons, because it is quite expensive to buy antivenom, whether in the public or private sector. In the public sector, a vial of antivenom could cost about $5 to $6 a single vial. In the private sector is about double that amount. And most of those people literally live on under $1 a day. So asking them to buy antivenom to treat them is very expensive, and this is what keeps them away and makes them prefer to go to a medicine man who will then accept to take a chicken or a sack of maize in exchange for treating them. Of course, like I mentioned, snakebite incidences happen in very remote areas, and so of course the distances to the facility is also another hindrance, because the hospitals are very far. The roads are really not roadworthy, which means there's no easily accessible public transport, and it's very difficult for them to get to the facility. And so for them, the only option that is left to them is actually to go to the traditional healer or medicine man that is really in their own backyard. So those are just some of the reasons that community members still use traditional methods when they're bitten by a snake.
Yeah, I think that's a very important point. One other thing that I've heard a lot is that snakes, even venomous snakes, can sometimes give a non-venomous bite. Can you tell me a little bit about that and how it may contribute to misconceptions about traditional medicine?
Absolutely. A venomous snake can actually give an unvenomous bite, but also the majority of snakes that actually exist are actually non-venomous. So one of the things that we have discovered is that while community members use traditional methods and think that those methods work, we hypothesize that perhaps the reason why they think they work is that in most instances, either they were bitten by an unvenomous snake, or they were bitten by a venomous snake that did not inject any venom into their system. And so whatever method they use, of course, the recovery is going to be very quick and very fast. And they have that misconception that those methods are actually working when they were actually just lucky to have been bitten by a snake that is not venomous at all. And this is really why we feel community engagement, community education, community sensitization is really, really critical if we are going to achieve any of the milestones that were envisioned in the WHO snakebite and venoming strategy.
Yeah. And last question, let's say I get bitten by a snake. What should I actually do?
Yeah, that is a really good question, Chloe. When you're bitten by a snake, the first thing that we tell everybody is to stay calm. Staying calm can actually save your life, because when you stay calm, you really reduce your heart rate, which means you're actually reducing the rate at which the blood is pumping and flowing in your body. And which means that if by any bad luck you've been bitten by a venomous snake, then the rate at which the venom is actually circulating is a lot more slower, giving you a lot more time to go to the health facility. So staying calm is the most important thing that we advise community members to do. Of course, the other things that we advise is that the patient should be taken to the health facility as fast as possible. But in the meantime, in the case of a spitting cobra or a spitting snake, if the snake happens to spit any venom in your eyes, we also advise that you use clean running water to completely rinse out your eyes before you go to the hospital. Of course, we highly discourage the issue of cutting the wound. We highly discourage the issue of tying around the bite site or using any traditional methods. What we are telling everybody, and our constant messaging, is that take any patient that has been bitten by a snake bite to the health facility, because it is impossible to tell just by looking which snake is venomous or how a venomous bite manifests unless you are a trained healthcare worker.
Great. Thank you so much for sharing your expertise, Dorothy.
Thank you. Thank you, Chloe, for having me. It was really a pleasure sharing some of the work that we have done.